Yep.
Hello, welcome to On Either Side of a Beat. My name is Michael Demoli. I'm the clinical director at Colorado Medication Assisted Recovery, CMAR, and this is.
Cortland Mathersuter. I'm the administrator at CMAR. And we are here today.
What are we here today to talk about?
We are here today to talk about, um, frankly, a life saving and revolutionary medication that is still kind of underutilized a bit
Absolutely.
called Vivitrol. So, Michael, tell us a little bit about Vivitrol.
Sure. Vivitrol is a once a month injection um, that it's a medication that is an opiate blocker.
What's that one? Is that naltrexone?
So naltrexone is the same. Naltrexone is a daily oral medication, and Vivitrol is the same medication taken in a once a month
Got it.
injectable form. Um, so it binds to the opiate receptors in somebody's brain, and it blocks opiates from binding to those receptors. Vivitrol or naltrexone in and of itself doesn't create any euphoric effects. It is not intoxicating, it's not habit forming, it's not addictive in any way. All it does is block other opiates from attaching to somebody's brain. It prevents somebody from getting high on opiates.
So that's a pretty different, similarly important but very different drug than Suboxone.
Correct.
And can you just quickly describe the difference?
Sure. So it works on the same part of the brain, but it works in a different way.
Okay.
Suboxone binds to those opiate receptors and it produces a mild opioid effect. Some of the benefits of that is that it maintains somebody's tolerance to opiates. So somebody is at high risk of relapse, or if they do have a relapse when they're using Suboxone, they're less likely to experience overdoses, which is a very important part of that medication. Vivitrol, it will prevent somebody from getting high when they're on that medication. But once Vivitrol wears off, if they have a relapse on opiates, they no longer have a physical tolerance to that opiate. But
Right, and that's the danger.
that can be a danger of
Got
that
it.
medication over Suboxone or an opioid antagonist.
So if I'm, is this? I know that buprenorphine or Suboxone is very much like it is an opiate treatment. With there's some research about stimulants and stuff like that, but at the moment it is primarily just it's an opiate treatment.
Correct.
Does Vivitrol have that same kind of strict benefit when it comes to when related to opiates, or are there other drugs or things that people could benefit
Sure.
through it from?
It is most effective with opiates,
Okay.
but it is also shown to have a fairly high degree of effectivity with alcoholics or people who use alcohol.
In what way?
Well, in that alcohol, when it's metabolized, it goes through many different pathways,
Mm-hmm.
but one of those pathways is through the opiate receptors in the brain. So although it won't prevent somebody from getting drunk, it'll actually reduce a lot of the euphoria that you experience when drinking alcohol, which is just more, it makes it more likely for an individual to return to treatment, for them to not enjoy their alcohol experience, and for them to want to seek sobriety again in the near future.
So it's almost a safety net for those really difficult nights we don't call our support system.
Sure.
We get into an argument with our family. We've got, a day or 10 years clean. Having this medication in our system is going to make it so that when we do go out and drink, that desired effect is not going to match what it did before we started using that medication.
Mm-hmm.
Okay. That's incredible.
It is. It is.
I wish they had that, or I wish I had been given that
And I
10
think
years
that's the
ago.
problem. It has been a medication that's been available for some time
Right.
now. It is just not a very commonly used medication. It's not a very popular medication. I think it's growing in its availability. There's a few reasons for that. It's an injectable medication, and it's not something that is. It requires somebody who knows how
Mm-hmm.
to administer the medication. It also can be an expensive medication. Luckily, it's covered by most, if not many insurance companies,
Mm-hmm.
but there is a barrier to access